No physical contact, observe social distancing, and please stay at home. For sex workers around the world, restrictions like these meant one thing: no income. Many were already in a precarious situation. In some countries, prostitution is illegal. In others, they face prejudices, racism, and exploitation. The pandemic made the situation for them even worse. Some were able to change how they did business, using modern technology in the world's oldest profession. But many didn't have that luxury. Protests followed. In countries like Germany and South Africa, sex workers took to the streets. They demanded to be treated like normal workers, calling on their government to do more to protect their livelihoods and health during the COVID pandemic. I'm Janelle Dumalaon, and this is your COVID update. Sex work remains a taboo in many parts of the world, but it is a reality for some of society's most vulnerable people, who often find themselves pushed to the margins, cut off from the safety net many take for granted. The COVID-19 pandemic has only made things worse, leaving sex workers to choose either to expose themselves to a deadly virus or face hunger, debt, and even violence. Today, we take a look at how sex workers in Bangladesh are coping with the crisis.
The nature of Ruxana's profession puts her at particular risk of contracting COVID-19. She's a sex worker, but she hopes getting a vaccine means getting back to work. In these last 2 years, we have almost gone out of work. There were days when we had to starve. People died of COVID-19 around the world, and we nearly died of hunger. We learned what hunger is. The women here are taking part in a one-day inoculation drive. They work nearby at Bangladesh's largest brothel. It's one of a few Muslim-majority nations where prostitution is legal. Health officials started giving out the AstraZeneca vaccine to sex workers earlier this year until supplies ran out. Now they've restarted the scheme using the Sinopharm jab. Bangladesh has received millions of the Chinese-made doses through the WHO-supported COVAX initiative.
We have almost 700 to 800 sex workers, regular sex workers in the brothel. In last few days, from February, we have inoculated almost 200 sex workers, and now we have prepared for 400 more jabs today to give this mass vaccination.
Only those 25 years and above are eligible for the jab. At 26, Ruxana makes the cut, but many more at the brothel are underage and remain unvaccinated.
Let's bring in Sabina Rahman. She works for the HIV/AIDS Research and Welfare Center in Dhaka. Thank you for joining us. Health officials are working to vaccinate Bangladesh's sex workers, but are they doing enough?
So what we believe is in the country which is very highly populated, and with a sex worker population of almost 140,000 over here, the government is trying its best to at least, vaccinate those in the brothels. So it's not quite those who are outside of the brothels that are getting the attention, because those who are residence-based or street-based are not treated the same as those in the brothels. So if we are to talk about are they doing enough, as someone who works in HARC and sees all the situation that's around, I would say no, even though there are a lot of initiatives being taken, which is a step in the right direction. But there's still a lot of work that needs to be done, especially for those who are not only in the brothels, but also who work in the residences or street or in the hotels.
What more should they be doing?
I would say in terms of giving aid, in terms of giving them national ID cards, because not all of them have national ID cards, which prevents them from getting a lot of services here, especially like vaccination is one of the things that stops them from getting vaccinated. Those, especially the street-based sex workers, are the one who don't have an address when it comes to getting a national ID card, and that's what prevents them from receiving a lot of healthcare or receiving vaccinations, such as the COVID vaccine. And I would also say government actually provided aid only to the brothel-based sex workers, but not those who are outside of the brothel. So that is definitely something we are trying to bring into attention. And also organizations, non-governmental organizations are actually mainly the ones who went forward to help them and not the government itself.
Now, as we saw in the report there, one woman said people are dying of COVID and that some have nearly died of hunger as well. How are sex workers there coping with the pandemic?
So as soon as the pandemic started, as soon as the lockdown went into effect, the sex workers, they immediately had to close down. They had zero clients, basically. They had no clients. And there was so much fear about COVID-19. Like, people didn't understand much about it. They were really, really scared to go to the brothels. They were really scared to go outside even initially. And a major challenge here is that sex workers don't have savings. Like, they are not able to save money for themselves. They are always either giving it away to their partners, their husbands, or their boyfriends, who sometimes forcibly take it from them. So that's something that when we talk to the sex workers here, that's a big major topic that came up. Like, they had no savings. They were under tremendous pressure. They had a lot of psychological distress. They called the HARC hotline, just asking for some sort of psychological counseling even, because they just couldn't take the pressure. They faced increased domestic violence because their partners were at home and they were all suffering from great financial distress, and their partners took out their angers by beating up the sex workers because of a lot of conflict. And that had actually shown us that there was a spike in domestic violence because of COVID-19 as well. And not to mention about the health impact as well.
Right.
There were basically no, all the clinics were shut down. Even normal people, like, they couldn't go to the doctors because the doctors themselves were scared of COVID-19 in the very first few months. And they didn't want patients to come in. Even now, a lot of hospitals don't accept COVID patients. So you can't just really go in even today. So
you're describing quite a series of challenges for sex workers in Bangladesh, but I want to take it back to the vaccine drives. Is there any chance that could lead to an improvement in their situation?
Yeah, that is something that is what the government is hoping, that it could improve opening up the country again, the economy again, so that everyone can go around freely without fear, so that hospitals won't be so crowded anymore, because a lot of hospitals are just are working above capacity. So it is definitely the government is hoping that by vaccinating everyone, they actually recently started a vaccination drive for the general population as well. So, I mean, like, anyone can go there and just get vaccinated. So all of the hopes that everyone will just be able to live normal lives again.
Samina Rahman in Dhaka, thank you very much for your insights.
Thank you.
Time now for one of your questions. Over to our science correspondent, Derek Williams.
How is the Delta variant affecting unvaccinated children under the age of 12?
When the pandemic really began to hit hard in the spring of 2020, one of the few positive pieces of news was that younger kids, for some reason, just didn't seem to get it very often. And when they did get it, they nearly always had mild cases of the disease. But the Delta variant might be altering that equation. In Britain, a country where, like in most of Europe at the moment, Delta has become the dominant variant, a recent big preprint study found that compared to people over 50, it was now 2.5 times more prevalent in those under 50, a group that included kids down to the age of 5. In the US, where Delta now also dominates the COVID landscape, numbers of infected children have been rising steadily. Healthcare authorities there last week reported 4 times more kids are currently testing positive for the disease than were back in July. The experts are still trying to figure out exactly what's causing the spike in cases in kids, but many believe it might just come down to the fact that Delta is simply a lot more transmissible overall, especially among unvaccinated teenagers and adults. In other words, the more cases you have in those populations, the more often younger children will also be exposed. And the more frequent the exposure, the more likely young kids are to get it too. But at least despite higher rates of infection, there's still no really convincing evidence that the majority of under 12s are getting a lot sicker on average than they do with other variants. And among those who have tested positive for the virus, it's also still true that a very low percentage actually end up in the hospital. So cross your fingers that it stays that way.
And there's been a setback in the fight against another epidemic threatening the health of sex workers worldwide. Johnson & Johnson's highly anticipated HIV vaccine has failed to demonstrate adequate protection in a clinical trial. 2,600 young women in sub-Saharan Africa were administered with a vaccine. The jab proved safe, but its efficacy in preventing HIV infection was just 25% in Africa. And that was it from us. Thank you for watching and stay safe.